Hey guys, welcome to the channel. The session is on pancreas. Let's jump right in. Pancreas is present in the transpyloric plane at the level of L1 vertebra. It is a retroperitoneal organ except for the tail part of it, which is present intraperitoneally. In the abdomen, it is present in the epigastrium and left hypochondrium regions. Relations of pancreas. First, stomach. Stomach is present anterior to the pancreas, and while tracing the stomach, you can see that it is separated from the pancreas by the lesser sac. Also, stomach and the pylorus part of it is present anterior to the pancreas. Second relation is the duodenum. It is present lateral to the pancreas and it curves around the head of the pancreas. Transverse vesical colon attaches to the anterior surface of pancreas and it is a derivative of dorsal mesentery in the embryo and it contains transverse colon, the middle colic vessels and its branches. Common bile duct is another relation and it descends behind the head of pancreas before opening to the second part of duodenum alongside the major pancreatic duct. Here you can see the bile duct coming posteriorly and it is joined by the major pancreatic duct and opens into the second part of duodenum. Spleen is located posteriorly and laterally. Here you can see the spleen and it is connected to the pancreas by the linorenal ligament, which is formed by the peritoneum, and it connects the tail of pancreas and spleen. Vessels which are in relation with the pancreas are the aorta and the inferior vena cava. Both are present posterior to the head of pancreas. Here, which is what you see here is the aorta and the inferior vena cava is near to it. There is superior mesenteric artery behind the neck of pancreas and anterior to uncinate process. This is a superior mesenteric artery which is derived from the aorta and it is present posterior to the neck of pancreas and it is anterior to the uncinate process. Here is the uncinate process which goes behind the superior mesenteric artery. There is splenic artery which runs along the superior border of pancreas. Here you can see the splenic artery. This is splenic artery. Another relation is the splenic vessels, splenic vein and the superior mesenteric vein, which unite to form the hepatic portal vein posterior to the neck of pancreas. And that you can see here. Here is a splenic vein and the superior mesenteric vein, which runs posterior and joins the hepatic portal vein. So these are the relations of pancreas. Coming to the parts of pancreas. There are 5 parts to pancreas: uncinate process, head, neck of pancreas, body, and tail. Head is the widest part of pancreas. Superior mesenteric vessels, which is formed from the aorta, forms behind the neck of pancreas and it goes anterior to the uncinate process. Tail, which lies in close proximity to the hilum of spleen, is contained within the splenorenal ligament, which is the woolly part intraperitoneally. The duct system. The exocrine pancreas is classified as a lobulated serous gland which produces digestive enzyme precursors in the acinar cells. The intercalated cells unite with those draining the adjacent lobules and drain into the network of intralobular collecting ducts, which in turn drain into the main pancreatic duct. Main pancreatic duct joins with the common bile duct and both then drain into the second part of duodenum. Here you can see the bile duct coming, joining the main pancreatic duct and draining into the second part of duodenum. Vasculature of pancreas. The pancreas is supplied by the pancreatic branch of splenic artery. The head is additionally supplied by the superior and inferior pancreatico-duodenal arteries, which are branches of the gastroduodenal and superior mesenteric artery, respectively. Here you can see the splenic artery supplying the pancreas. Venous drainage of head of pancreas is by the superior mesenteric branch of hepatic portal vein, which I have shown you before, and the rest of pancreas is by the splenic vein. The pancreas is drained by the lymphatic vessels that follow the arterial supply. They empty into the pancreatico-splenal nodes and pyloric nodes, which in turn drain into the superior mesenteric and celiac lymph nodes. Here I'll show you the lymph node. Here these are the splenic nodes and here is the superior pancreatic nodes. Celiac nodes are present near the celiac trunk, and here are the superior mesenteric nodes. Coming to the applied anatomy of pancreas. First, annular pancreas. The pancreas develops from ventral and dorsal buds from the foregut. The ventral bud forms the head and uncinate process of pancreas, and the dorsal forms the rest of pancreas. Usually, the ventral bud rotates and goes to its normal position like this. But when it doesn't rotate, there will be two pancreas on the either sides of duodenum. This can cause constriction of duodenum. After birth, the child may fail to thrive and may vomit due to poor gastric emptying. The obstruction during fetal life may prevent the fetus from swallowing enough amniotic fluid. This increases overall volume of amniotic fluid in the amniotic sac surrounding the fetus, a condition called polyhydramnose. Pancreatitis. It refers to inflammation of pancreas, and the causes can be remembered using the mnemonic "get smashed," which are gallstones, ethanol, trauma, steroids, mumps, autoimmune disorders, scorpion sting, hyperglyceridemia, hypercalcemia, hyperparathyroidism, ERCP, that is endoscopic retrograde, cholangiopancreatography, and drugs such as sodium valproate, azathioprine, and sulfonamides. Pancreatitis causes severe gastric pain, epigastric pain, which often radiates to back, and it can cause nausea, vomiting, and diarrhea. Treatment usually involves supportive measures such as IV fluids and analgesia. Pancreatic cancer accounts for a significant number of deaths. The malignant tumor of pancreas may occur anywhere within the pancreas but are most frequent within head and neck. Non-specific findings in patients are upper abdominal pain, loss of appetite, weight loss. Depending on the exact site of cancer, obstruction of bile duct may occur, which can produce obstructive jaundice. So these are some of the important aspects in anatomy and applied anatomy of pancreas. I will share the link to the PDF below. Give it a like if you found this useful. We'll come up with better videos. Thank you. Good day.